Hello, Assalamu alaikum. My name is Professor Faisal Dar. I am a liver transplant, hepatobiliary, and a pancreatic surgeon. I am working at Pakistan Kidney and Liver Institute and Research Center in Lahore as a transplant and hepatobiliary surgeon, and at the same time, I am Dean or a Chief Executive Officer of this hospital. PKLI was conceived back in 2015 with the idea to provide best quality healthcare to the patients with liver and kidney diseases. So, at the time of the concept, along with Dr. Saeed Akhtar, who is the founder of this institution, we agreed that we should be working on four basic fundamentals relating to liver and kidney diseases. One was to provide best of the best medical or a surgical treatment to the patient with liver and kidney diseases. Secondly, we wanted to create a center of excellence for education and training of doctors and nurses and paramedical staff. Thirdly, we wanted to work or create an environment where we can work for the prevention of liver and kidney diseases in Pakistan. And fourthly, we wanted to create a center where a cutting edge research can be performed. So these are the four basic aims of this institution. So PKLI started its operations a few years ago, but before it can mature into an institution, unfortunately, there was a dark period of 2 to 3 years uh, due to our political and judicial system that the institution was kind of pulled back for a few years. But later on in 2021, with the support of the government, we restarted uh, PKLI functions. And in the last 4 years, we have developed into our institution where all the medical and the surgical care for liver and kidney patients is being performed to the best of it. Just to give you a few examples, in the last 4 years, we have done more than 1,000 living donor liver transplantation in this hospital. We have done more than 1,200 kidney transplants in our country, and we have done about 7 or 8 deceased donor transplants, including liver, kidney, and pancreas. And more recently, we have started doing bone marrow transplantation. So, on the clinical side, we want to transform PKLI into a great transplant institution. I think with our numbers and the quality, we are already probably in the top 10 centers in the world. Our results are matchable to any good centers in the world. We have published our results in medical journals too. So the quality of the work being done at PKLI can be accessed through our published articles. On the prevention side of a thing, we are just laying the foundation with the help of our 18 filter clinics in 18 districts of the Punjab, where these filter clinics are connected via telemedicine to the main PKLI in Lahore. So our filter clinic teams are not only working to treat hepatitis and B and C, but also trying to educate the communities about basic health things and about the liver and kidney awareness. On the research side, again, we have laid the foundation of our research department. We have different MOUs with the local and the international universities. We are recognized by the Drug Regulatory Authority of Pakistan for phase 1 to 3 clinical trials, and we are trying to bring different trials to our institution. On the education and the research side, uh, all the disciplines of PKLI or recognized by the College of Physicians and Surgeons of Pakistan for postgraduate training, including fellowships in liver transplant, kidney transplant, interventional radiology, pathology, diagnostic radiology, gastroenterology, transplant hepatology, and all the disciplines of pathology as well. Last year, we have also started our College of Nursing and Allied Health Professionals, and this year we're going to take the second session. So, with all these advancements and with the basic function of the institution in place, November 2024, we got accredited by the Joint Commission International, putting a kind of a golden seal to our patient safety and quality procedures. So, since PKLI is predominantly supported and funded by the government with a mandate to provide free of cost service to the poor segments of the society, subsidized treatment to the middle class, and the one who can afford should be paying out of their own pocket. So far, in the last few years, 80% of the patient population coming to our doors is given subsidized treatment. More than 50% patients are absolutely free, which are funded by the government grant. Another 25% of the patients get discount, and majority of these patients in this category get 80 to 90% of the discounted treatment, and only 20% of the patients are paying from their own pocket. So with increasing number of patients coming to our doors, and with time the government is cutting down on its grant, PKLI is trying to create avenues for its more and more funding. Our ultimate aim is to provide absolutely free of cost service to all the patients with absolute dignity. But for that, we need people like you to support this institution. So far, our 60% of the budget is funded by the government, which is going to be less in the next year and even less in the next years. About 25% of our budget is supported by our own revenues, and the rest we have to arrange from funding. Could be zakat, khairat, sadaqat, or by the local or the expatriate donors. So I think PKLI is becoming or transforming into a great institution where poor patients are being served with the best of the best treatments, whether it be transplants, whether it be medical treatment, a procedure with the interventional radiology, or an advanced endoscopy, or a robotic surgery. Everything is here under one roof. But to continue to keep with the latest innovations in the medical technology and to maximize free treatment to most of the poor patients, we do need help and support from you. I hope you will come forward and help the cause of PKLI taking it forward. All the best and thank you very much.